New this morning, if you've been dealing with a runny nose and itchy eyes, you are not alone. Trust me, spring is here and so is allergy season. But how do you know what's normal allergy symptoms and what could actually be a cold? Northern News Now's Hannah Morgan spoke to two doctors to learn more and joins us live from the newsroom. Good morning, Hannah.
Good morning, Madison. So as temperatures rise, so do pollen levels. The Weather Channel reports tree pollen is at a moderate level this week in Duluth, and health professionals say it can be easy to confuse allergies with a cold. Kenneth Uke, a pharmacy resident with Aspirus Health, says a runny nose and congestion can happen with either one. But watery or itchy eyes are more likely with allergies, while body aches and fever point to a cold. And if you're struggling with allergies, there are medications like once daily tablets, but Uke says it's important to understand side effects since some can cause drowsiness. And he doesn't recommend those for people who are prone to falls.
Some people have congestion when they have allergies, so they might turn towards things like Sudafed as a decongestant. However, Sudafed can also raise your blood pressure, has an increased risk to cause arrhythmia. So if you have heart problems, you might want to watch out for that as well.
And pediatricians over at Aspirus Health are also seeing an increase in asthma and allergy symptoms among children. Pediatrician Chris Coaster says many kids are still recovering from late season colds and flu. He says if a child suddenly can't keep up with peers or comes home unusually tired, it can be a sign their asthma or allergies are starting to flare.
Parents can make sure that the filters in their the heating and air conditioning system are changed as frequently as they should be. Also, if you have carpet, frequent vacuuming.
And he says that as the season progresses, families should stay attentive to symptoms and reach out with concerns. And if symptoms last longer than 2 or 3 weeks, include a persistent fever, or fail to improve with over-the-counter treatments, follow up with a primary care provider. Reporting live from the newsroom, I'm Hannah Morgan at Northern News Now.